And I know that some of the members have already heard me say this, but the number one issue when I'm out in my district, when I talk to my businesses, small and large, is about federal regulations. And now with the ObamaCare coming on, it's really front and foremost in a lot of people's minds. And I'd like to give you a couple of examples here. First, I represent a district that has 60,000 manufacturing jobs. Again, large and small. I also represent the largest ag district in the state of Ohio, which is kind of an interesting way to have a district, but I'm very, very proud of it. I also have a lot of entrepreneurs out there that really want to get out there and employ people. But when I've had over, according to my office, over 330 meetings at businesses and factories with farmers and across the spectrum at universities, schools, and colleges, and also at hospitals, they're very, very concerned about this law, especially what's happening, especially when I heard that you hear about these, you're saying you only know of isolated instances. So maybe I could do is kind of point out more than I'm hearing because, you know, we're on the road in our districts all the time. And one of the things also I find interesting is that from the CBO, when they said recently that we're still going to have 31 million people uninsured in 10 years. And is that correct?
I'm sorry, I don't know which one you're referring to.
With the Congressional Budget Office, when they came out with a report that we're still going to have 31 million people still uninsured in this country in 10 years?
I'm not familiar with that.
Okay, I'd advise if you could look that up. Let me give you a couple of examples because, again, since you said that you're really not aware of these isolated instances, again, we're the ones that spend our time in the car in our districts. But this is on a one report that came out from one of our local television stations about a gentleman that they interviewed, that he worked at a restaurant, that he's going to have his hours cut because the owner of the restaurant said they just couldn't make the payment when it came on the insurance side. And so what's going to happen to him is going to happen to a lot of people in this country. The owner tried out there finding other ways of cutting hours instead of cutting the employees because he wanted to make sure people could have a job. But the problem is now, in this gentleman's case, is that he's going to have less than 30 hours that he'll be working a week, and the worker reported that he'll lose about $400 a month for fewer hours having to pay the health insurance. And when he said he added it all up, he's going to have $27.50 a week to live off of. These are not isolated instances out there. Let me give you another example. I'm getting calls from colleges and universities. I'm very blessed to have quite a few in my district. These universities and colleges are calling me saying that the folks out there, these students, are having their hours cut right now. And they're getting fewer hours. So it's not only that they're not going to have problems with getting health insurance, but the other problem they're going to end up with, they're going to have fewer dollars to be able to pay for their tuition. That's not an isolated instance. That's going across my district. I'll give you another example. I went through two companies just not too long ago, and it was very odd. It was back-to-back with both of these companies. One had 35 employees, the other had 45 employees. The one with 45 employees had a business that could expand right now, and they said they could double their business and double the amount of employees up to 90. But they're not going to do it. Why? Because they will not expand over the employer mandate of 50. So what protections out there are we going to have for, especially on the administration side, what protections from these penalty increases do employers have if they choose to pay that penalty? Are we going to see this penalty increasing? What's going to happen to those folks for the employers?
You know, I will give you an isolated incident back about the Affordable Care Act. I met with an individual this past weekend who was employed, state government, lost his job. He's an attorney. He's back on the individual market, so he's paying $1,500 a month for his insurance. His agent called him last week to let him know that with the Affordable Care Act, he could look for that to half because he'd have some buying power in the small market. So when I say isolated incidences, I've met with large employers in Georgia, in Florida. I've met with small employers. I've been all across this country, and I'll continue to do so. And I will try to work with them. But there are stories of both examples, and that will continue to be the case.
Madam Chair, my time has expired, and I yield back.